This presentation will help you to understand the major types of crowns, their physical properties, and the aesthetic characteristics of each. Please ask your dentist any questions that arise after watching this video. Crowns have become one of the most commonly used dental restorations for teeth that are significantly broken down by decay or trauma. There are various types of crowns, and you and your dentist will determine the best type for you. These restorations are like a stocking cap on your head. Just as a stocking cap covers your head, a crown covers most or all of the carefully shaped portion of the tooth that is exposed into the mouth. They strengthen the remaining tooth structure. The model you're observing has two teeth prepared for a gold crown and a porcelain fused to metal crown. You'll note that they're quite different. There are currently 4 types of crowns available to you: porcelain fused to metal, all ceramic, gold alloy, and resin. Are there alternatives? Do you have to have a crown? Ask your dentist. Sometimes large fillings can be used instead of crowns. The advantages of crowns, however, they're very strong, and for some types of crowns, the aesthetic qualities are similar to natural tooth. What are the disadvantages of crowns? They have a higher cost when compared to typical fillings, and their risks, just as with fillings, occasionally decay is so deep that root canal therapy is required. And infrequently, portions of the crown may break off during service. The following discussion includes the 4 basic types of crowns. It will assist you in making the decision about which type of crown to have placed in your own mouth. Porcelain fused to metal crowns are the most commonly used crowns today. Dentists prepare the teeth for crowns. Usually dental technicians make the crowns and dentists cement the crowns onto the teeth. This process requires artistic and technical ability on both the part of the dentist and the technician. The following technique images will introduce you to some of the steps in making a porcelain fused to metal crown. These 2 teeth are significantly decayed and require crowns. This tooth has been prepared for a crown by the dentist. And you're seeing a model of the prepared teeth onto which the laboratory technician has placed some gold paint. The metal is on the inside of a porcelain fused to metal crown, and the outside is a beautiful ceramic simulating the actual tooth structure and anatomy. These crowns have been fabricated for the prepared teeth and seated onto the model by the laboratory technician, and you'll notice that they simulate the natural tooth right down to the little grooves and crevices that are in a natural tooth. They're then cemented into the mouth by the dentist, and look at the beautiful result that is obtainable. These look just like natural teeth. All ceramic crowns comprise a significant portion of crowns placed around the world. Their strength characteristics range from moderately strong to as strong as a porcelain fused to metal crown, which is as strong as a tooth. They can be used on both front teeth and back teeth. Some types of all ceramic crowns have excellent aesthetic properties, among the best in dentistry. These crowns do not contain metal. Why would you want them? Some people, especially women, have allergies to the metals used in some dental crowns, and the gums around the crowns become really inflamed. If you have a rash on your skin adjacent to metal jewelry, especially earrings, you should consider all ceramic crowns. As an example of a metal allergy, please notice the gums on the upper 4 front teeth on the left image. These crowns have metal underneath them, and the woman is severely allergic to that metal. The image on the right shows the same patient with all ceramic crowns on the 4 upper front teeth. What a difference! The metal allergy is gone. This plaster model shows 1 lower molar tooth that has been prepared for an all ceramic crown. And the laboratory technician has made a beautiful all ceramic crown now ready to be cemented into the mouth. And this is a model of an upper front tooth that has been prepared for an all ceramic crown. The laboratory technician has constructed that crown, and the dentist has seated the crown. Very difficult to discern it from a natural tooth. Gold alloy crowns have been used in dentistry for over 100 years. They're still the longest lasting crowns. However, they're gold colored. But if placed in the back portion of the mouth, they're not observable when smiling. Note this dentist patient who desires to have the longest lasting restoration available from the dental profession. In spite of the extreme amount of gold covering the chewing surfaces of the teeth, very little gold shows from the smiling view. With adequate hygiene, these restorations will probably continue to serve for most of this person's life. If your bite is especially aggressive, in other words, you grind your teeth all the time at night or during the day, and you do not prefer to have gold alloy crowns, resin crowns may be the answer because porcelain crowns will grind the opposing teeth. Although these crowns will not serve as long as gold crowns, their appearance is very good and they do not wear opposing teeth. These crowns become slightly rough over a period of time, and the opposing teeth wear them a little bit more than the opposing teeth wear themselves. That's probably the reason these are the least used crowns in dentistry, but they may be the best for you. Ask your dentist. In summary, there are 4 types of crowns available today. In most cases, your dentist will recommend porcelain fused to metal crowns. Crowns are relatively similar in cost, so you're not really looking at the money as much as the characteristics of the crowns. In certain situations, all ceramic, gold alloy, or resin crowns will be recommended. Regardless of the type of crown you and your dentist select for your mouth, you should expect many years of service from the crowns. After they have been in your mouth for a short time, you will not be able to tell crowns from the natural, untreated teeth. Crowns are among the most successful treatments in dentistry.